Basic first aid kit essentials. Bandages. Used to cover wounds and stop bleeding. Antiseptic wipes. Used for cleaning wounds to prevent infection. Gauze pads. Used to dress larger wounds and control bleeding. Scissors. Used for cutting tape, clothing, or bandages. Adhesive tape. Used to secure dressings in place. You can purchase or assemble your own first aid kits, from a store, online, or by gathering supplies themselves. Assessing the situation. It's very important to assess the situation before providing first aid. Always remember safety is the top priority. Before approaching a victim, ensure that the scene is safe for you. Do not put yourself in danger. Look for any potential hazards that could harm you or the victim, such as traffic, fire, or unstable structures. It's necessary to call for professional help. And provide essential information about the situation and location. ABCs of first aid. A for airway. Check if a person's airway is clear. This involves gently tilting the victim's head backward and lifting the chin to open the airway. If the person is unconscious, this step is crucial. B for breathing. Let's learn how to perform CPR, cardiopulmonary resuscitation, including chest compressions and rescue breaths. The hand should be properly placed, heel of one hand on the center of the chest, and use compression technique. Compress at least 2 inches deep and at a rate of 100-120 compressions per minute. C for circulation. Let's learn how to check for a pulse on the carotid artery, neck, and provide chest compressions if there is no pulse. It's important to maintain a steady rhythm and depth in chest compressions. Bleeding and wound care hacks. Let's learn how to stop bleeding from various types of wounds. Direct pressure. Apply firm pressure with gauze or a clean cloth to the bleeding wound. Explain that this helps promote clotting and stops the bleeding. Tourniquet. Tourniquet should only be used as a last resort for severe bleeding, such as arterial bleeding. Loosen it after a short period, usually 2 hours, to avoid tissue damage. Let's learn how to clean and dress wounds properly. Cleaning wounds. Clean the wound with antiseptic wipes to prevent infection. Dressing wounds. Cover wounds with adhesive bandages or gauze pads and secure them with adhesive tape. Choking and Heimlich maneuver. The person may try to speak but cannot produce any sound or cough effectively. This is often one of the first signs of choking. The most immediate danger in choking is the risk of asphyxiation, where the person cannot breathe and their oxygen levels drop rapidly. Without intervention, this can lead to brain damage or death within minutes. To perform the Heimlich maneuver on a choking victim, stand behind them, place a fist just above their navel, and grasp it with your other hand. Deliver upward and inward thrusts to force the obstruction out of their airway. Seek professional medical help afterward, even if the victim appears fine, and perform CPR if necessary. Emphasize the need to call for help if the victim cannot breathe or loses consciousness. Burns and burn care hacks. First-degree burns. Superficial burns affecting only the top layer of skin. Second-degree burns. Partial thickness burns that involve both the top and underlying layers of skin. Third-degree burns. Full thickness burns that damage all skin layers and may even affect underlying tissues. Treat minor burns with cold running water. It helps cool the area and alleviate pain. Use the over-the-counter burn ointments and when to seek professional medical attention for more severe burns. Allergic reactions and epinephrine. Severe allergic reactions, anaphylaxis, are characterized by difficulty breathing, noticeable swelling, and the development of hives on the skin. To use an epinephrine auto-injector, EpiPen, on someone experiencing a severe allergic reaction, first remove the EpiPen from its protective case. Next, firmly press the tip of the EpiPen against the person's thigh, through their clothing if necessary, and hold it in place for about 10 seconds. Seek immediate medical help afterward, as using the EpiPen is a temporary measure, and professional care is crucial for managing anaphylaxis. Stress the need to seek immediate medical attention after using an EpiPen.